name is Dr. Jeffrey Goldberg. I am the dentist and owner and orofacial pain specialist at Atlas Orofacial Pain and Apnea Group in Buffalo, New York. Patients come to see us because of two main reasons: pain and sleep problems. And we have a bit of a slogan for our practice, which is less pain, better sleep. And we try to keep it just that simple and just that complicated. It's what can we do to help people have better sleep, to sleep better, and to have less pain on a daily basis or a long-term basis. So the kinds of problems that we solve, a lot of them are what they call TMJ disorders, temporomandibular joint disorders, problems and pain associated specifically with the jaw joints. Often related to that are headaches, functional issues with the jaw, issues of clenching and grinding the teeth, and the danger that poses to the teeth in dental restorations, jaws that simply don't open or close or get stuck. Don't open or close the way that they should. These are the sorts of problems we help people with. We also do get into some other kinds of orofacial pain, including neuropathic pain, things like trigeminal neuralgia, conditions like what's called burning mouth syndrome or phantom tooth syndrome. So some different challenging issues that involve the teeth, the mouth, the jaws, and then again, in sort of a different category, but very much related, the sleep problems of sleep apnea and snoring, with the understanding that not only are these problems of their own, but you really can't fully manage pain if sleep is a problem, if sleep is not as good as we can get it. Probably the most obvious thing, the first thing is that we are an orofacial pain practice. Orofacial pain became a specialty in the American Dental Association in 2020, actually right in the depths of COVID, April of 2020. And we are the newest and quite possibly the smallest specialty in the American Dental Association. So there's really only a handful of orofacial pain specialists around. The fact that we have a practice that is specialized and focused on treating pain disorders, TMJ disorders exclusively is really unique in and of itself. It's always been my hope to have an atmosphere, an environment that has that boutique, very pleasant, very calm, and really is a reflection of the kind of appreciation we want to show to our patients. We want them to really enjoy coming here and feeling like it's a real, let's say, sort of an upscale experience, a really pleasant experience to be treating their condition and doing what they can for their own wellness, their sleep and pain in an environment where they're really taken care of and appreciated in this really sort of refined manner. Maybe the most important thing of all, the people that are here. We have just an exceptional team of people that really know and understand the kinds of conditions we treat, and even more so the kinds of people that we treat and how those people ought to be treated. So I think you'll find the people here are really outstanding. The first time a patient comes to see us, first of all, they will have already gotten to know us a little bit. We make it a policy to get a little bit personal ahead of time. We take a look at the information they provide through the computer about their condition, and I personally review every case. If there are questions, if there's concerns, or even just to get to know the patient a little bit better and help them be ready, we'll make a phone call and put one of our wonderful team members directly in touch. So they're coming in here already sort of familiar with us and us with them. That first visit is, if it's a TMJ or sleep case, hour and a half. We take the time to do some imaging, to do some exam and evaluation, but also to really listen. That's probably what patients tell us the most, that it's so rare to go to a doctor's office of any kind and have that opportunity to just sit and be heard and go through their experience and have it listened to with an attentive and educated ear to then move on towards what can we do, and then it's always a matter of presenting options, pros, cons, and figuring out together what that patient wants to do moving forward. Oral appliances or orthotics are really a mainstay of what we do. It's the thing that we tend to get the greatest benefit from. It's very non-invasive. It's a tremendous vehicle. I don't think a lot of people realize that mouth guards or night guards or orthotics, that there is so much variety. There's such a world of options within that particular type of vehicle or tool to help somebody. They're used in treating TMJ or temporomandibular joint disorders, all kinds of functional and pain issues of the jaw, clicking, locking, pain, of course, headaches associated with that. Some are worn at night, some are worn during the day, some are worn both. There's top ones, there's bottom ones, all different designs. And then we have a separate but related set of appliances that are used for sleep apnea to help hold the jaw in a position where you can breathe better. It's definitely a consideration. It's a standard of care. It is, again, non-invasive and very amenable. We get sort of into the arts and crafts of it sometimes to develop just a very customized type of orthotic that really exactly meets the need of the individual patient.